Hello and welcome to today's Experts Online session about remote care and the first-hand experience of remote care. My name is Alex Burtscher. I'm the product manager for clinical software here at MED-EL headquarters in Innsbruck in Austria, and it's my pleasure to guide you through this session. Before we start, I wanted to just give you a few housekeeping tips and tricks. So for one, if you could please name yourself in the Zoom meeting. So if you click on your name in the participants panel and then click on more and rename to put your name, to put your organization and or country, that would be great. So we always know whom we're talking to. Also, to avoid any background noise, if you can, please mute your microphone, especially if you don't speak. Also mute your phone if you join from the phone. And also for a stable internet connection, we do recommend to close all other programs on your device. But still, all comments and questions are very much welcome. Whether this is verbally or in the chat, feel free to type in any questions or comments or feedback to those points that we make. Additionally, there is English captioning available in this Zoom meeting. So if you click on the respective button on your menu bar, you should get closed captions for this meeting. And so to jump into the topic of remote care right away, let me tell you a little bit about it, what it is, what it does, and what it means for us at MED-EL. Essentially, our remote care solution is based on cloud-based data. So what does this mean? I mean, we all know the cloud, we all know data goes into the cloud, well, somewhere. But now we want to make it that there's the Maestro 10 fitting software where the clinician can work, of course, from the data that he or she knows of and has the whole patient record of the MED-EL CI user in there, but also that the patient has an app where they can perform certain tasks, certain remote care tasks that can help in facilitate this remote care data exchange. And this happens not only live, as you probably know it from remote programming as before, so that you really need to schedule an appointment, you need to have a stable internet connection, you need to have a video transmission and an audio transmission to the recipient to perform such tasks. So we designed remote care in a way that it can also work independently from all these aspects. So that means a recipient with the app, they can perform certain tasks whenever they want, as often as they want, and wherever they are. And then data is still stored in the cloud. And this data can then be reviewed by a clinician whenever the clinician has time. So it doesn't need to be at the time when the patient does all these tasks, when the patient is online. So this can be done by the end of the day, for example, if there is a few minutes left, or if there is a dedicated admin time for remote scheduled, for example. It could also be the next day if it's not a pressing issue. And vice versa, the clinician can perform certain tasks in Maestro, i.e. a fitting, setting up a configuration for an audio processor, and then send it also to the cloud, from where the recipient can then download such a configuration and install it on their audio processor by themselves. So you see, there's no need to really, as I mentioned before, schedule an appointment, to be online at the same time, to perform such routine tasks or fine-tuning tasks. This can really happen very much independently from each other. Also empowering the recipient with the app to look after their own system, as we will see, to get troubleshooting advice for whatever the issue may be. So to really save them a trip to the clinic, and also to save the clinician time by not having to really schedule this appointment for, say, a full hour where it can only be managed in a few minutes. Now, what does this mean for the recipient? How does the app look? Well, the app's called HearCare MED-EL. You may have heard about it before. In many countries, it's already available in the app stores. You can go and download. It has a demo mode, so you can play around with it, similar to the Audio Key app. But what is integrated in there? What the main new thing with the HearCare MED-EL app is self-checks or those system checks that a recipient can now do wherever they are and whenever they want to with their implant system. And that is for one an implant check, and the other one is an audio processor check. The implant check is essentially a whole telemetry as you know it from your Maestro face-to-face clinic visits. It's doing exactly the same things. It's measuring all the impedances, gram path impedance, the whole impedance matrix and everything, but on the patient's phone. And as I said, as often as they want, they can do it once a day, once a week, once a month, up to really the recipient. There's also the audio processor check, which checks their external device, whether it's a Sonnet 2 or a Rondo 3 audio processor. It can check the microphones. So similar to what you see in Maestro and what you may use in clinic, it will measure each microphone individually, tells you the difference, and tells if everything is in order or whether there may or may not be a need to change the microphone cover. It also does a coil check. It also reads out the various error patterns potentially of a processor. So what you usually only see via a flashing LED pattern would then be explained in the app that there is an issue going on and what the next steps would be to fix such an issue. So again, as I mentioned before, empowering the patient to really look after the system and get the next step to get the issue resolved. Of course, it will always mention that if the issue persists, to please contact their clinic and their healthcare provider to really get the issue resolved, which may not be possible remotely. That's one thing that the patient can do with the app. The other thing is that they can really do a backup of their audio processor settings. Now, why is this good? Well, a backup is always good. I mean, I think we can all agree on that. But the audio processor backup can be especially useful if a recipient experiences an issue with their processor, if they need a replacement of an audio processor. They can, usually a recipient would let the clinic know there is an issue, and if a replacement processor is needed, someone needs to pre-program the processor and send it off to the recipient. Now, this is not needed anymore. The recipient can receive an empty new audio processor and can program the backup onto this new processor by themselves. So there's no need to preload that processor with their respective settings. Again, saving time in clinic, or at least in the administration part of the clinical work. And the patient can really start from where they did the backup, and that should reduce hearing downtime significantly, because the audio processor doesn't need to go through that loop of being programmed before and only then can be sent out. So that's also a pretty handy thing for the recipient. And I mentioned they can also install a fitting map by themselves that they are provided with by the clinician. And all of that happens in Maestro 10, the providing part. And just to show you how remote care is integrated into the new Maestro 10 software, Maestro 10 has now a dedicated remote care session. So you know there's an intra-op session, there's a post-op session, and now there's also a remote care session. In this remote care session, the clinician can review those system check data that we just mentioned. So they would see the results of the implant check, they would see the results of the processor check, and they also get this audio processor backup delivered into Maestro if available. The implant check is shown in the exactly same screen that you would review your telemetries that you do in clinic. Also, the display is very much the same. So as I said before, the implant check that is done on the smartphone is exactly the same as doing it in Maestro, but from the patient's home, from the patient's phone, delivered to you via the cloud. The patient, by the way, on the app sees only a very, very condensed result display. So they would see a green check mark if there is no issues at all, or they would see a little orange exclamation mark that indicates a warning and there might be something going on with the system, and then leading further to more troubleshooting advice. So they only see very, very limited information, whereas you as the clinician, you see everything. And on the other hand, as I mentioned, you can upload a whole configuration. So again, from the remote care session view, you can just go into the fitting task. You can make any change to a fitting map that you want. So there's no restrictions. You can change any of the MCLs. You can change any of the other advanced fitting parameters as well. So this could be tiny changes like a little volume boost, or it could be something like a map law change that you want to provide to your patient remotely. And you have the freedom to do everything of that. And then instead of programming the audio processor on site, you upload this new configuration, this new map to the cloud, and then it's stored there. At the same time, or a few moments later, the recipient will get a notification that there is a new configuration available. And then again, whenever they have time, whenever it's convenient for them, they can install this configuration onto their audio processor. So it might be that they are getting a new configuration during the day, they might be at work and they don't want to change the setting right away. So they can do it later in the day, or even the next day, or on the weekend when they really have time to install the new setting. That only takes a few minutes, but then also to listen to it for a while and decide whether they want to keep it or go back to the previous setting. And this is where the backup comes in again, because you can really also here go back to your previous setting if you don't like the new feeding parameters, for example, from the recipient's point of view. And that's essentially the workflow of how the system is designed to be. And I mentioned that you have all feeding parameters available there as well. And this gives me now the opportunity to hand over to our guest speakers. First and foremost, to Dr. Dayse Tavora-Vieira from Australia. So she's the head of audiology in WA statewide audiology services, and that includes, I always have to look this up, the Fiona Stanley Fremantle Hospital Group, the Royal Perth Hospital, and the Sir Charles Gardner Hospital as well. So you're a very busy woman, and thank you very much for taking the time here with us, also considering the time zone. And we also have Helen Court here. She's a cochlear implant recipient. She's sitting in Queensland in Australia, so where it's even 2 hours later, and we also very much appreciate you being available for us for this session today. Thank you both. And yeah, without further ado, I would hand over to Dayse to share her experience with this remote care system.
Thank you, Alex. Thank you for the introduction, and thanks for the invitation to share our first experience. And I think that once I show you my first slide, you are going to see why I put my hand up for this very soon. Because what I'm going to show you is the Western Australia experience. And for those who are not familiar, that is Australia, right? And what we have here, let me just put my laser on. This is Perth, this is where I am, and this is Western Australia. So this state is 1/3 of the country. And if you don't know how big Australia is, I made sure that I put it here on top of Europe for you to have an idea where our patients come from and the distance that they need to travel sometimes. So we are here, we are the state program, so we have patients from all the way here. That would be a good few hours flying. You guys would have crossed a few countries and we would still be flying within our estate. And what we have, the reality is we have patients flying to Perth for mapping in situations where we could probably save a lot of time, effort, and money, to be honest. So what we have done for the last 10 years is that is our center. And what we have across the states is most centers, what we call telehealth centers. So what we do is when we have a patient who do not want to come to Perth, or for whatever reason they cannot come, what we do is we send the Max box to that place, and we have several of them across the states. So I'm just kind of making sure that all these patients are looked after without traveling But what we have to take into account is that we are still sending equipment to these small sites that are not a hospital, can be just like a very small center near where the patient is. So we are not sending to the patient home, of course. We still need to send equipment, the right cable, and we need to have somebody on the other side. So here is an example. We have a patient in 2 hours flying from Perth, and we have somebody, we are using the telehealth equipment that works very well, I have to say. And we need somebody on the other side that usually is going to be a nurse or a speech pathologist, let me just turn this here, or a patient family, or sometimes the telehealth officer. We do need to make sure that whoever is on the other side is capable of connecting everything for us. So that is what we have been doing for the last 10 years. So our dream has been to be able to do this without sending the equipment. So the idea is that, can we do this without any equipment whatsoever, where the patient can be at their place? So that's something that we have been waiting for very anxiously. And so that's what we are hoping to do with this app. So that is what we would like. What I'm going to do here now is share with you our experience with our first 17 participants. You can see on the screen that is very variable. So you can see like the age. We had kids, we had elderly. So we have patients 70 plus all the way to 85 years old. We had different conditions. We wanted to make sure that could work with everyone. So you can see here, single side deafness, few single side deafness there. We have highlighted all the issues, for example, what is the special circumstance where we would like to use this technology with these patients. For example, the 2 kids, for example, is very interesting to be able to provide them help when they are at school. They don't want to miss the school to come to the clinic. So that is something that we can do. You can see that this patient there is 3 hours flying from Perth. So if we can do it without this flight, is definitely a plus. Another one, 3 hours driving, another one, another 3 hours drive. Anything from Perth is actually something like that. You don't have anything less than 2 hours driving to Perth. So another issue that we face, a patient who had transport issue. We do have a quite elderly population in terms of implant users. We have patients up to 99 years old at the moment. That transport is a difficult. We are talking about a big hostel, it's a big campus. I'm sure that a lot of people are in the same situation. So it's a lot of walking, parking is difficult. So if they don't have family anymore, if they don't have people to bring them to the hostel, sometimes we have to organize ambulance, so the cost of this can be quite high. So I just highlighted there some of the patients who actually had transport difficulties or walking difficulties. Even they have family to bring them over, they have walking difficulties to come from the car park to the center. So we need to organize a wheelchair and all this that is relevant to these patients. So what we did, what you, Alex, introduced the idea, and of course, what he's introducing is the fact that you can help these patients without they coming to the center. What, in my experience, was like, even is one step ahead, because what we want is to use this technology to replace our conventional remote programming. We are going to do exactly the same thing, but we don't need to send equipment, and we don't need somebody on the other end to be connecting. We organize an appointment. Is still a video call, so the patient has the facility for lip reading, to help with lip reading, but the patient is at home. So we are removing all the other steps, and the patient is at home. We organize an appointment the same way that we organize, but it's a video call, and the patient is doing everything with us on the screen. So we remove the traveling, we remove the equipment, but we are still doing everything that we need to do with this patient. It's not live, as Alex said, is still is in the cloud, it's not live, but the time that it takes to do all the process is actually much shorter than the remote map, the traditional remote mapping per se, because it is we don't have that issue in terms of connecting the equipment, having somebody available to be with the patient. So it actually works much better for us. So what I'm going to do is share with you one patient that, because then gives you an idea how it works. With this first patient, we wanted to make sure that is working, it was reliable. So she's actually at the hospital, but she's sitting in the courtyard. And we did everything pretending that she was at home just to make sure that everything was working. So I'm just going to play this video for you. I hope that it works. Good. Sally, what we are going to do is just to practice how the remote care is going to work for you from home, okay? Yes. So you have your app on your phone. What I need you to do for us to start the remote care is to check the system for you. So can you please go on the top left-hand side and click on system check? Yep. Just the instructions on this screen. Yeah, it's ticked. Yeah, and that's it. Is it saying that there is no problems found? No issue found and a green tick. Okay. Now I have it with me and I'm just uploading into my system. Okay? Yes. Okay, Sally, I have it now. What I'm going to do is I'm going to create a new setting just for you to try, just for us to make sure that everything is working. I'm not going to make any change on your sound processor. I just want to make sure that if I send you something, you are going to be able to download it into your processor, okay? So make sure that you have the phone on and I will send you a new map. Okay. All right. So now what I'm doing is I'm uploading the new setting for you. Yes. Yes, just that. Yes. And then it should show you that there's a new configuration created today. Install new configuration created today. Do you want me to press that? Yep. Just press that. Done. Yep. Is it all done? Yep. It's come up with side left, Sonic, a serial number, and new configuration provided. Perfect. Okay. Configuration installed. That's awesome. It probably Sally sounding a little bit different than what it was. It feels very dull. As I've been switched off. Perfect. I did it on purpose just to make sure that it is working. You can see that it's working. Okay, so in this video, the reason why I played it all could be a little bit boring for some, but it was just to show you that it is actually the real time. The editing was just cutting from one camera to another. is definitely very quick. So as soon as you say send, the patient will take a few seconds and the patient see on the screen that is available. So for us it works really well because we can do this within the appointment time. As I said, in our centers, what we have is this system where the patient receives a video call. We use this as a standard of care. So it's a video call. The patient is in front of the screen as long as they have a computer, anything, or telephone. They have the video call with us, and we do that using the sound processor. So it really complements our service. And the next video that I'm going to share with you, and I promise that's the last one because then you don't fall asleep, is the one that we did with Helen. She's our next speaker. We wanted to make sure that we do have patients, for example, that move temporarily across the country and they don't want to move clinics, they want to be with us, and it is allowed. So we don't have any restrictions in terms of not be able to do that. And we have patients, for example, if I put bear with me, I'm just going to put my laser. We have patients, for example, that have moved temporarily all the way here and wanted to be looked after by us because they feel that it's not necessary. They are not going to be there long enough to warranty a change of center. So if we need these patients, if we need to help these patients, we wanted to make sure that actually we can use the same technology. So we recruited Helen because she was the perfect one to help us out. So that is the distance where Helen is from us. So we are talking about what, Helen? 5 hours drive, flying, I think, 5.5 hours. So we made the experiment. So I'm just going to show you the video and you are going to see what we did. So it is my understanding that you have the app installed and we are pretty much good to go.
It's on my phone.
Perfect. Now we should be able to do the system check.
Okay.
So if we do that.
Yeah, so I've just gone to the little icon in the corner and system check. That's correct, it's my left side. And I'm going to hit next. All right, and I'll hit start check. Oh, I got a green tick next to my implant.
Good. Let's wait for the sound process and I should be able to see it here on my screen as well.
Okay. And I got another green tick. So I'm going to just click on the done bar. Hopefully we'll send it to you.
And I already have it. I have one configuration, I have one fitting, and I have one telemetry test. So I'm going to download this to my computer.
Okay.
It's downloading and it is done. All right. So I have your last map that was created on the 4th of February. Does it sound correct for you?
That's right, yes.
Okay. What are you going to do, Helen? I'm just going to open it.
Yes.
And make an adjustment just for us to make sure that everything is working at a long distance. So what I'm going to do is I'm just going to increase a couple of steps up to make sure that you are able to see the difference. So I have it there. And now I'm just going to upload and you should receive I need you now to go back to the menu again.
Yes. Oh, I've got a little new configuration available. It just popped up onto my, without even going to the, yeah, I've gone back to the dashboard.
Yes.
And I'm going to click on remote care, configurations. And I have a new box saying install new configuration created today. So I've clicked on that and then next. And then install. Ooh. Okay, I've got green ticks on prepare configuration, create backup, and it's just installing the configuration.
Perfect. So, and one thing, Helen, is that actually you can just go back. If it's just too loud, you can just go back to your backup, right?
Okay, yeah, absolutely. Okay. Alrighty. Oh, that's sounding good. I like that. Yeah. No, I think that sounds better.
So it is my understanding that you have. Okay, so these two videos just to show you how it worked, and as I said again, it was not edited making it short. It was exactly the time that was taken for Helen to download the new configuration. So that is our ideal setup. So we have activation at a hostel. We have optimization at very early stage using some sort of objective measures to make sure that when we send this patient away, they have the best map that they can have, and the follow-ups, the ongoing care could be done at their home, their place, or when they need. So that is our ideal. And with this, I thank you very much for listening.
Yeah,
Thank you very much.
I am a CA parent. Can I? Oh, sorry.
No worries. I think we can go straight into some questions if there are. We have one in the chat, but then feel free to enable your microphones also and start the discussion. No problem. I may start the one with the question from the chat. And that was, were all elderly patients or participants able to use remote care autonomously, or was there some on-site assistance required?
That's a very good question. We anticipate that probably we will need to, but with these patients, was not a randomized clinical trial, was really convenient recruiting, because we're patients who actually had upcoming appointments. In this case, we had one patient that we needed to have the daughter available because he doesn't have the phone. So we need to get in contact with the daughter to get everything installed in her phone. The same way that we would do with the kids. For example, the kids was the same. The mother was present in this case, in both cases of the two children. And we do, and it's a good point, we anticipate that some of these elderly patients, they will need assistance.
Thank you. There's another question. So you're using the changes synchronously with a video call, what we saw in the video. How are you validating those map changes?
That's, again, it's a very good question. So what we are hoping to do with that, we have the short answer is not. We are relying on what the patient is telling us. This is no different from the remote mapping anyway, because with the remote mapping, what we do is they know that they have to come to the center once a year for us to do all the tests, because we are a teaching and a research hostel, so we would like to have them face-to-face at least once a year for the testing. So that's when we find out if it's not going well. But usually what we do with our remote mapping for people who live quite far away and is not going to stay in the metropolitan area, we give them different maps, like if they just have the switch on and go away, and if they are able to travel to some center that are close to them, at least for like a Puritan free field threshold, that's how we get some results. I agree that is that's something that we are working on, and I think I'm hoping that the app is going to be we are going to be able to do this at some stage, right? So I hope that Alex can tell us what to do with the app itself. I know that is available. We are not using it. But yeah.
All right. Yes. We might come back to that when we talk about or ask the question like, what is there to improve or what's missing, and maybe more people chime in here. Are there any other questions from the audience to Dayse?
The question is almost similar to the number 2. I am a CI parent. Here, for my daughter's mapping, traditionally the audiologist checks at each channel, at each frequency. She keeps on doing some beep sounds. So is that kind of arrangement can be done here? Like the audiologist remotely sends some signal, and here my daughter gets it and says yes, good or bad or something like that. Some
Well, for this type of measurement, if I can answer, for this type of measurement, it needs to be really live, right? So that's what we do with our traditional remote, where we send equipment, and then we actually do all the measurements of the, you can hear, is it too loud, is it too soft? With this system, it is still not really live. So it is based on what the patient tells me, okay, so the sound has whatever has changed significantly in the last 3 months. So if we know that there is no change in the system per se, if there is no change on the sound processor, then we make adjustment based on what the patient is telling us, and then we send it over. He tries, she tries, and it then is live. So he's telling us within that 2 minutes, 3 minutes, whatever it is needed, to see is that an improvement. If it is not an improvement, we modify it again, and we keep doing this during the session. So it is not a really live measurements of the MCLs, if that is your question.
yes,
And that,
perfect. Thank
yeah,
you.
and that's another thing that I'm hoping that MED-EL is going to bring very soon.
Yeah.
I'll make a note of that. Yes. No, sure.
Thank you.
Yeah, no, and I think that's also the beauty of the options that we have here. So, I mean, you still have the opportunity to do remote programming as you did with, as Dayse pointed out, sending the equipment, of course, to a center and then doing all of this, if needed, synchronously. But now with the app and with Maestro 10, you can do it in a sort of semi-synchronous way, as we saw in the video, or completely independent. So you have like this whole range of remote programming available at this point, and you can really cater to everyone's needs. We have another question. Will the app be the same when it's downloaded from anywhere in the world? I have some clients that live in one country and get mappings in another country. Yes, so the app is indeed the same in all the app stores in all countries. So it's just a matter of who and how to connect to different centers from the recipient's perspective. So you can be connected to your clinic that you always visit. You can also be connected to more than one clinic. So in essence, the recipient is in charge of what happens with their data, who sees their data, and who can also get in touch with the recipient. So that's a very patient-centric approach that we took here. And yeah, also again, to fulfill multiple scenarios in that regard. I hope this answers the question. And there's another one. Does each processor can be fitted by remote in the remote way, or only Sonnet 2 and Rondo 3? And yes, at the moment, it's the Sonnet 2 and the Sonnet 2 EAS, and also the Rondo 3. What features does the app offer for the Rondo 3? For example, remote programming, real-time adjustment, data logging, mappings. Can the app be used to perform firmware updates on the Rondo 3? So the features are the same between the Sonnet 2 and the Rondo 3. There's a slight difference that with the Rondo 3, also the data battery status is transmitted to the cloud and to the clinician in the end. So again, very much the same as you see in Maestro with the processor check function that also displays the battery check. Also the app transmits that information. Not for the Sonnet 2 though, because with the Sync Air batteries, that is very, very hard to estimate. But for the built-in rechargeable battery of the Rondo 3, that's also being communicated to the cloud. And no firmware updates via the app, I want to say yet. That also comes onto the list for the future, but not at this stage. All right, I think that gets us through the questions in the chat for now. In the interest of time, I would move on and now introduce Helen Court. As I mentioned, she's a CI recipient from Queensland in Australia. She also happens to be a colleague of us, so she's also a clinical specialist in that very area. And it's a great pleasure to have her today You saw her in the video, and to share her experience from a recipient's point of view in that system. Thank you, Helen, for being here. I know it's very late, but yeah, we really appreciate you being here and share your experience.
No, thank you. It's been a pleasure to try out the HearCare app. And as a recipient, my experience with the app has been extremely positive. Mainly, I think, because it's so quick and easy to use. I'm super busy, as is everyone these days. So being so time poor, as you saw in the video, it's very quick to do a system check and obtain a new configuration. It really required hardly any fiddling around for me. And really, I don't think it could be any simpler. It was extremely easy to use from the app. I wasn't actually expecting it to be so quick and hassle-free. My experience with apps, the internet, smartphones in general, I was thinking that it may freeze or not work from time to time, but that hasn't been the case. And I really believe that it's going to be a massive time saver for everyone. So for patients and clients alike. It's obviously fantastic that I can get map alterations and a new configuration loaded from Dayse, who's over 4,000 kilometers away, right on the other side of the country. I actually liked the map that I got on the video and decided to stay with that. But it's very reassuring to know that I can easily undo any changes and go back to my previous map if required. I also like listening to the new map with Dayse actually in my own listening environment. My house here is very much made for the Australian climate. It's extremely reverberant. So it was fantastic to listen in this environment rather than in a soundproof clinic room when it does, you know, and everyone says it sounds very different. I think, as we've discussed, many patients find it's extremely frustrating to travel long distances, at times at great expense, for what is sometimes a minor issue. As Dayse said, here in Australia, people often have to fly or travel 3 or 4 hours or more to get to their clinic. So anything that reduces the number of times that they have to visit the clinic is a good thing. I think in these harder economic times, it's harder for some patients to get time off work, to get a babysitter, or travel to the clinic. Travel's expensive, and it's especially challenging for the elderly and infirm. And I think this remote programming and remote access is going to be more and more important as time goes on. So it has been empowering for me as a patient to have some control as to when I have to travel to a clinic, and also allows me to have more ownership of troubleshooting the processor. I think that's a very important thing. The app's a good way for the clinic to be able to check in with me, and much quicker and easier than them having to email and me reply, or having their receptionist try and get hold of me on the phone to see how I'm going. It's really easy to share data with my clinician, and they can then decide if an appointment is required. I really loved the system check because it's actually very reassuring to know that the system is working well, especially if I've been a little bit rough on my processor, perhaps being out in a very heavy rainstorm, or possibly, perhaps not admitting to it, but having dropped my processor. It's really good to know that it's working well. It's also really good to be told to change the mic protectors if you've forgotten to. So I think the app helps give peace of mind And I feel secure knowing that I can check both my processor and my implant at any time. As a parent, I know that if I did have a child with an implant, it would be amazing to be able to keep track of the functionality of my child's audio processor and implant. It would be easy to share data with a clinic and feel confident that the child's, hearing well, and you're keeping track of the system. I think one of the big things that the Hear app allows is that it's a game changer for traveling. It really reduces anxiety of traveling and what you've got to take with you, knowing that wherever I am, I can get a replacement device sent to me, and with my current configuration saved to the cloud, upload it at any time. Don't have to worry about trying to get emails sent with my mapping data sent from clinic to clinic, time zones, trying to sort all that out, different languages. I just think it's one less thing to worry about when traveling, and yeah, definitely gives me peace of mind. It's going to make any problems whilst overseas or traveling much, much easier. Overall, I think it's going to be really well received, and both clinics and recipients will benefit. Personally, I can't wait until it's released generally here. And if anyone's got any questions, please feel free to ask.
Thank you very much, Helen. Thank you for your insights on the recipient side. I think not often we have the chance to talk to the professional and the recipient of a mapping session. And yeah, I think we saw in the video that everything was really easy and very quick. And as Dayse pointed out, the only thing that was cut out was the waiting time on the app, which is, 2-3 minutes tops. We have another question in the chat, which says, is it possible to get a new map from a second clinician apart from my original clinic? And yeah, that's possible. So I mentioned somewhere in between that as a recipient, I can be connected not only to one, but multiple institutions or clinics. So that means data is then, of course, the data I create is shared to all those institutions. And also the data that the institutions share are then also shared amongst all the recipients, the data recipients as well. So yes, you could also be connected to a second clinic and receive a mapping from there. Granted, you as a recipient, you can still decide whether you want to install that new setting or not. So you don't have to. It depends on what the inquiry was in the beginning to change the map in the first place. But essentially, as a recipient, you're still in charge what you do with these data. And as Helen pointed out, that the empowerment of the patient is really key here to really decide on your own what's going to happen in this scenario and what is not. Another question is, what is the name of the app? I'm in Canada. I don't think it's available yet. Yes, so it's not released in Canada to what I know. It won't be too long. But yeah, you probably need to be just a little bit more patient until it also hits the Canadian App Store. But you can always talk to your local representative of MED-EL to get the current status of when it will be available. All right. So thank you both for the moment. It's now time to do the traditional group picture of the Experts Online sessions. And for this, I would kindly ask you to turn on your cameras and put on your best smile and maybe give us a wave. I'll wave with our very own Expert Online cup. And our colleagues here, they will take a screenshot, and we'll wait until a few more pictures come on maybe. Very good, okay. 3, 2, 1, smile. No, it's great to see everyone, and we're really happy to have you all on board here. Beautiful. Thank you very much. Feel free to leave the camera on for the discussion. I think if any one of you has a question to Dayse or Helen, feel free to go ahead. We have a few more minutes, for that. If not, I mean, I also wrote down a few questions. You already answered a few of them, which is always good. So, in essence, when you heard, probably to both of you, when you heard first about this new concept of this independent remote care, what were the expectations, or were there any concerns before you could actually go and try it out? Maybe Dayse, from a professional point of view, did you immediately think that solves all our problems? I'm happy to give it a try.
Well, I didn't think that was going to solve all our problems. And one of the reasons actually was one of the questions that one of the participants asked before is like, for example, and I remember having this conversation with someone in the past, is that from a research perspective, like, because we are still really rely a lot on conventional methods to report outcome, right? Although I think that we are kind of probably changing this a little bit, but to date, we still rely on all the speech tests and all this stuff for research. So if the patient doesn't come to the clinic, if you are thinking that this is going to replace completely all the visits, then research becomes an issue. Because you want to collect data. So and another thing that I have made very clear for everybody who talks to me is that I see this as an extra tool, not as a replacement, for the visit, but I think that it helps in a lot of situations. And I was very pleased when we tried that, particularly for the elderly. We do have a lot of elderly patients that transport is a big issue. And to be able to check on them, I don't know, if every 6 months, for example, without bringing them to the clinic is actually very reassuring for us and for the family. These are my main concerns, the elderly and those who live far away. And as I said, we are doing the remote mapping anyway. So these patients are not coming to the clinic many times as people who live locally. But what this does is really make it easier, because we don't need another person and we don't need equipment. So what I'm really looking for is to be completely synchronous. So to be live, to be able to do the whole test. Using this technology.
No, and I think that's great. And as you say, it's easier and probably also saving some time or some time in the schedule by filtering or assessing those recipients, whether they actually need to come to the clinic or whether you can gather some data remotely and then say, okay,
Absolutely.
You're good to go for another 6 months.
Absolutely. No, it does save time. It is the appointments that we had, it was half of the time than the traditional remote mapping using equipment.
Which is huge, yeah. I mean, we all know the workload gets a lot more, recipients are getting more, appointments are getting more, but you need to save time somewhere. And that's where we also see the strength of this concept, but not only the recipient saving time, but also at the clinic saving time with all of this. Also to you, Helen, when you first heard or looked at the app, what were your expectations? And then were they fulfilled to some extent?
Yeah, I think that the app was great that you can do the telemetry, not just check the processor. So that was very pleasing that that is included. I think that, yeah, as Dayse said, once it's fully synchronous, it will be, fantastic. But yeah, I was very pleasantly surprised that you'd be able to do telemetry with it.
Yeah, we also got this feedback from many other recipients who were already able to try it, that this is now, yeah, having the possibility to do this anytime now, whether it's for them or someone else they care for, is really a game changer. And I mean, we mentioned it before, it's empowering to them to do all this. We have another comment in the chat from India. There, I can see the HearCare MED-EL app in the Android Play Store. Does that mean the facility is already there in India? Well, the app is there, yes. It's available and it can be used, well, wherever it's available, of course, from the get-go. So if you download the app, if you log in, if you pair your audio processor with it, you can start to do these system checks, the telemetry, the audio processor check right away. Also, the backup function is there. Even if you're not connected or even if you're not sharing your data with a certain clinic or facility there, you can still do it for yourself, for your own peace of mind and for your own record. Should a clinic would approach you for remote care or vice versa, you can still share this particular data, also historic data, with the clinic via remote care. But the app, of course, also works without the data sharing. Maybe some people don't even want to share the data, which is fine as well. So this is why we chose this patient-centric approach, so that really the patient's in charge and they can decide to share or not to share and with whom to share. Right, I mean, we got a few more minutes. Maybe we use that on, yeah, where to go from here. And I think the question goes to everyone in the audience. If you have any particular requests or points that are missing in here yet. We heard the live synchronous fitting. Of course, that's one of the next steps that's expected. We also heard about checks that go towards performance tracking. There is already the MED-EL remote check available in some countries, not everywhere, but there's a tool available that also features audiological tests, noise testing, and so on. I also heard or read about firmware upgrades, which might be a need. Is there anything else that you would like to see? Maybe Helen, from a recipient point of view, is there anything that you would like to do by yourself in addition?
That is a good question. I guess with I'm a Rondo 3 user, and so troubleshooting is kind of very simple. But I guess with Sonnet 2, troubleshooting of specific parts might be a good idea. So knowing if it was your cable or coil, although they seldom go wrong, it might be nice to have that troubleshooting ability.
All right, thank you. Dayse, besides live fitting, any other thing that you would like to, any other info you would like to receive from the app to your desk?
No, I don't know if it is a big dream, Alex, but I would like, for example, to be able to have the video call through the app.
Yep.
Because at the moment we still rely on the hostel system for the video conference. So I think that if we have the video call through the app would be amazing.
Absolutely, and I'm sure that will go hand in hand with a live fitting too, because that's not possible without the other, more or less.
Yeah.
Okay, sounds good. And I like looking at your videos that you did and the one that you both did, because it always shows, well, one, how it works. So that saves me some speaking time in some occasions. And then on the other hand, it really also shows that, as I said, this semi-live approach, that you can still do it with the patient online, of course, if you wanted to, and that you have the freedom to use that if that's the protocol, for example. One last question from the chat. How reliable is the app in maintaining a stable connection with the Rondo 3? Are there any performance issues reported by users, such as lag or crashes? Of course, it's very reliable. Now, from what we heard so far, it is indeed very reliable. We haven't had any reports of, well, lags or crashes so far. I mean, Helen, feel free to correct me, whatever your experience is so far. But at least personally, I haven't heard anything alike, and more of the opposite, that it's, yeah, pretty fast, pretty easy to do so,
Yeah.
even though the tests are often done in a faster way that we anticipated them to be in terms of how quick a system check is.
Yeah, I definitely was surprised at how quick and stable it is. Where I live in Queensland isn't exactly well known for its stable and good internet connection. So most technology has some glitches, but with the app, it's been absolutely perfect. No problems whatsoever. And I've
I
been
think
using.
this is the best way how we could end this session. It's 4 o'clock here in Innsbruck time. It's a lot later where you are. Again, thank you both very, very much for being here, for answering our questions, for sharing your experiences. Again, very, very much appreciated by the whole team here. Thank you so much. And yeah, that brings us to the end of today's Experts Online. I want to encourage you to also join the next Expert Online session, which is going to be on the 26th of June. And it's going to be about the state of knowledge on anatomy-based fitting. Very exciting topic. I'm sure I'm going to be there, and I hope many of you are as well. Thank you very much. Thank you, Dayse. Thank you, Helen. Thank you so much. Thanks for everyone for joining today, and I hope to see you soon.